Welcome to the Lunch and Learn. My name is Eric Keys at Refined MD, and it's nice to have you here. We're showcasing one of our newest pieces of technology. I'm also here with Dr. Stephen Swengel, board-certified dermatologist and founder of the company. Tell me a little about the new piece of equipment we have.
Well, this is the Emsculpt Neo, which is the newest piece of technology that BTL has come out with, which I think is just basically gone way beyond what the original Emsculpt can do. And the reason being that it actually has two different technologies all wrapped into one with fully adjustable modes so that we can adjust the product based on your needs as far as muscle building and as far as fat reduction.
So truly, this is like innovative, kind of first in class, right?
Oh, absolutely.
That dual technology?
Absolutely. It still is based on the electromagnetics, the high intensity electromagnetic forces for muscle toning. And for those of you who have never had one of these treatments in the past, I think we've made arrangements with BTL to actually do a live demo on one of their clients. And I'd certainly like to have everyone come and watch it because it's not a difficult procedure. We are there, we can adjust the treatment to make sure that you're comfortable through the treatment. But the whole focus is to try to get you to take as much muscle stimulation and as much heat as you possibly can without feeling like we've injured you.
So it should be a tolerable, feel-good treatment.
Right. I mean, as I said, the first time I did it, I thought, I'll just go right up to 100%. It's like, no, I can't do that. But if you're in the 70% and above, you're still getting a very good treatment.
I know I've been talking to your body treatment specialist, Bella, and she says she's never had anybody not be able to complete a treatment. So, I mean, that's a good sign. She ramps people up gently through the treatments, and she says they all find it very tough.
Well, I think the other one too is that obviously people who are already pretty muscular and pretty gym fit, they've got muscle amounts that are much bigger. So you got more muscle that can respond to this. If you're a little less of a gym rat, you've got a little more of padding of fat. It's kind of hiding under there. So you can, and those people often go zipping up to close to 100% easier than you can on someone who is really very physically fit to begin with. I still remember the one chiropractor we saw who was very, very fit. He couldn't take 20%, and I think that was unique and kind of, I've never seen that before. But I think it just shows you that if you've got good muscle mass to begin with, this is a very powerful system on fit muscle. So
speaking of that, how does this differ compared to normal like electrical stimulation of muscles?
Well, again, it's a totally different way to stimulate muscle, and you have to think about the synapse to the muscle. And if you are physically doing your crunches, your brain is through the nerves is telling the muscles to contract. So there's a limit as to how much the muscle contract with that sort of stimulation. If you have electric stimulation, and a lot of these muscle stimulators are actually that, they are again stimulating the muscle through the synapse. So the muscle is not getting as much of an intense stimulation as it is with this, which is basically stimulating the muscle on the other side of the synapse.
Because this is an electromagnetic field, as
Correct.
Opposed to electric shock.
Right. The other is just electric shock. And you can get these home models. You can get some improvement, but it's definitely a much less intense and efficient way to stimulate muscle.
So let's talk for a moment about where this can be used on the body parts.
Yeah.
Is this? I imagine it's large muscles.
Well, again, with these paddles, it's large muscles. So it's your abs is obviously the first one that most everyone does. Buttocks, your thighs, your upper thighs have large muscles that can handle it. Now again, they're coming out with smaller ones that kind of would fit biceps, triceps, calves. I've even done my deltoids and my trapezius when I dislocated my shoulder just to strengthen muscle. So as long as you can get it strapped on and comfortably oriented so that you really feel that muscle contract, you can treat for all muscles except your pecs.
Nice. So this is Emsculpt Neo. This is a device that comes out of Eastern Europe, specifically Prague. We have several pieces of equipment from BTL Aesthetics. There it is. In our practice, we have a device called Vanquish, which is off here to my left. We have a device, this is Excelus, I'm sorry. We have a device called Vanquish. And we have the Emsculpt Legacy treatment, which is the original Emsculpt, as well as Emsculpt Neo. So we have several pieces of equipment.
We also have Emsculpt.
And we have Emsculpt, which is an important piece of technology, which is this electromagnetic energy, this high intensity focused electromagnetic energy, also known as high FEM energy, in the form of a chair that you can sit on. And this chair helps people that have stress or urge urinary incontinence, kind of mild to moderate urinary incontinence, to solve that problem. It's a really nice treatment because you don't have to disrobe, or you don't have to have necessarily a physical exam. It's just you can sit on a chair, do these pelvic muscle contractions, also known as Kegels. The chair forces the patient to do those. And most patients respond very favorably within as few as 2 treatments. Right. But a normal treatment cycle is 6 treatments with an Emsculpt chair.
And I think it's for people with mild to moderate stress incontinence, because what it's really doing is just tightening all the entire pelvic floor. Mm-hmm. So I think it's a really great system because as we all age, those pelvic muscles, particularly after pregnancy, become stretched and weak. And so if you're the person who's has that slight leakage when you're doing yoga positions, or where your doctor has said, no, you don't need surgery, or no, you don't need any sort of implanted device, do your Kegels. I think this is a great way to take care of that without having to do your Kegels.
So Emsculpt, we'll feature that in another video so that you can get a chance to, one, see a treatment and kind of experience it more firsthand. But thank you for joining us today for our Emsculpt Neo debut. We look forward to having you in our office for an individual consultation for our body sculpting services, which are varied. And we do offer free complimentary consultations because it's something that you really need to be assessed for in person. And you need the experience of somebody who has all these modalities in their office, so they're not just selective for one or the other, but we really have a full range of devices to help you. Thanks for attending. Hi, I'm Eric. And I'm at Refined MD. I'm here with our newest device. It's called Emsculpt Neo. Emsculpt Neo is kind of the go-to device for both fat busting as well as body toning. So we're seeing patients that get in the area of 30% fat destruction in the areas treated, as well as 20% muscle hypertrophy, so increase in muscle mass in those areas. So better toning and fat destruction. Kind of treatment.
Let's do it.
Okay. So we're going to go ahead and I'll take my shirt off here, kick back on the bed, and Dawn, you put me up. So it's important to remove any metal in the treatment zone. That's why I took off my belt. And this is a little problematic too, probably the button. So I usually have patients just fold back the tops of their jeans.
Okay, so we're going to put the 2 applicators on.
So, in all honesty, I've done 2 treatments prior. So I had a treatment initial treatment about 3 weeks ago, and another treatment about 7 days ago. So this is my 3rd treatment.
Okay, I'm going to go ahead and start it.
Okay. Oh, I feel a little warm.
Yeah, I started the warmth. Now I'm going to gradually get the contractions high.
Okay.
How does it feel so far?
Easy.
Okay, let's go higher.
So in other words, are you going to, do you ramp people up gently in this treatment?
Yes, I gradually get patients up to 100%. That's what we typically like to get patients. Everyone's different, so depending on how they can tolerate the treatment. I like to start them off slow, so it's 10%, then you're at 30% right now. Still okay?
Oh yeah.
Okay, and then with time, I just get them up. It's like you're working out. You need to warm up first, and then that's when you start doing your sets.
So, I mean, I think the most effective, the tapping usually, isn't it just to keep your muscles more comfortable, drive the lactic acid out?
Yeah, there's different sets of tapping, so One helps break apart the lactic acids, the other one is for the contractions to build, and the other one is to help with the radio frequency.
This feels very easy.
Are you still okay?
Yeah, I'm fine.
How does it feel on the warm side?
At this point, it feels mildly warm.
Okay.
So, I think for patients that are trying to decide whether they need Emsculpt or Emsculpt Neo, I think the best way to get a good answer is have a consultation with one of us in the practice, because we've done hundreds, if not thousands, of treatments on patients using all different types of body toning modalities, so we can help you select the right treatment for you. Emsculpt is a little less expensive than Emsculpt Neo, than the newest device, but you do have to consider that this is kind of a two-in-one device. You're getting all the kind of the fat-burning qualities.
And you're saving time.
You're saving time, which is valuable here in Silicon Valley. So we've got them both. We do offer complimentary consultations for body sculpting, whether it's fat reduction, skin tightening, just body contouring. Bella has consults available usually Monday through Friday. So we welcome you to come in. We are offering special packages, pricing packages at time of consultation. So it's really worth it to come in for a in-person consultation with us.
Yes.
Probably should mention that we have very COVID vigilant employees that always wear masks in the building, and we've implemented many safety protocols as far as UV light air filtration systems and HEPA air filtration. So feel safe coming in. We do observe proper COVID-19 protocols.
How are you doing?
Got a question?
We have a question. So, how many treatments would you typically buy for Emsculpt Neo? Is it similar to regular Emsculpt?
Yes, it would be the same. So typically 4 treatments. For this one, we want to do it at least once every 7 days, just because you're getting the radio frequency in it too. So we want to give it a little bit more time for the fat cells to melt and for the muscle to get built. What do you say?
Yep, that's right. All the studies, this device was extensively studied for the past 18 months in the U.S. And people's treatment regimens varied between 3 and 6 treatments, and ultimately the recommendations for the device is that you treat 4 times, anywhere from 5 to 10 days apart. And those patients had optimal results about 6 weeks after the 4th treatment. So the muscle continues to build and grow after the treatment is completed. Like I said, optimal results is 6 weeks after the last one.
Does it feel hot already?
Definitely some warmth, and the warmth, the vibration is a little bit of a distraction. I definitely feel all the pulling. Where are we, Bella? Are we at 100%?
Not there yet. You're at 75.
75%.
You want to go higher?
Yeah, let's bring it up. Yeah, definitely feel the strong contractions. I think one also point to observe is the average person that underwent treatment for this lost just under 6 centimeters of circumference after 4 treatments. So that's about 2 inches of waist reduction or stomach reduction. So pretty significant, nearly a dress size, I believe. So these are powerful contractions. Yeah, feel it.